This is the stream of COVID-19 coronavirus. It swept the world in just a few months. With the outbreak of COVID-19, great changes have taken place in technology and society. People tend to shop online and work from home. Are these software really safe? Chinese and South Korean government use big data to check people infected with the epidemic. Does this touch the bottom line of personal privacy? We are going to figure out, in the state of emergency facing the global health crisis, what changes have taken place in our privacy and security. We will try to discuss these issues from 3 different perspectives: business companies, governments, and individuals. To begin with, we need to understand how privacy and security are closely related to technology and society. Since the outbreak of COVID-19, the usage of social media increased a lot. Governments have better technology used on supervision to check patients. More people prefer to shop online and food delivery. People have to use video and collaborative office softwares to work from home. When you use these technologies, you always put your personal data at risk. The COVID-19 has a huge impact on global community, making a lot of things change. The safety of user privacy is closely related to social stability, so privacy is very important to us, and it is also true to society.
The outbreak of COVID also has great impacts on business companies. It generates much more benefits than usual to companies. For example, before COVID broke out, the number of users of Uber Eats inclined steadily. However, when it comes to 2020, the time that COVID broke out, the number of users of Uber Eats rose to 66 million, which is more than 3 times that of 2019. The user data that Uber can obtain from it is unimaginable. During the epidemic period, Zoom, TikTok, and other companies also developed rapidly. As people spend longer time on their phone, these business companies are more likely to control their information privacy and suggest items they will buy. This might cause customers overconsume on their phone. Worstly, customers' information may be sold to other business companies, and they are likely to receive more spam calls and emails, which seriously affect their daily lives. By misusing user data or even sacrificing people's privacy, business companies are more likely to gain more economic benefits. In order to further protect users' information from being leaked, our government can make stricter policies in terms of privacy rules for these companies.
The emergence of COVID-19 lead governments must deal with the medical and health problems. Almost all countries use some softwares or technologies to track patients. For example, many public transport in China implement a temporary real name registration system, which means that all the daily trips of residents are recorded, and every citizen must use their health code to enter a public place in many cities in China. Those precise monitoring methods can help people discover their illness and treat them immediately, and facilitate governments to prevent a further spread of the disease. However, supervising people's traveling records has touched the bottom line of personal privacy. It is really hard for government to balance personal privacy and epidemic control. From the source, we can see that China and South Korea tried their best to track patients to ensure public safety, while European and American countries turned to control the health and treat personal privacy issues very consciously. Even now, it is still hard for us to judge which attitude toward this matter is better, whether protecting public health safety or keeping people's privacy.
However, the biggest group suffering from information privacy exposure is people themselves. As people are more inclined to put their information on the internet, the phenomenon of privacy leaks is becoming more and more common. In the Facebook data privacy scandal, there are up to 87 million people suffer from it. In order to avoid hidden dangers by private information leaks, people need to think carefully before putting their information online.
Under COVID-19 pandemic, people work and study online. They are facilitated by media data generated by applications such as Zoom and Facebook, but the risk of privacy disclosure is non-negligible. In order to manage the pandemic, some governments use the internet and big data to track the location and activity of patients without the knowledge of the citizens. This is true that the lives and health of them and other citizens are protected, but this does not respect personal privacy and is challenging the bottom line of ethics. On the other side, a large number of covered patients' information was leaked and widely spread online because of people's worries and fears about infected patients. This seriously affected the patient's daily life, work, and family. Even after they recover from illness, they may still be discriminated against by people around them. Government and medical institutions should not disclose information other than patients' condition, and it is their responsibility to protect its citizens' privacy. Information that loses value for pandemic prevention and control should be destroyed in time.